Welcome to the VetPractice Playbook, brought to you by VetPractice Pro, where we talk all things veterinary leadership, management, clinic ownership, and building practices that actually work for the people inside them. I'm Dr. Emily King, and I'm joined today by John and Caleb Biddles and Mr. Richard King.
Hello.
Okay, guys, you want to remind everybody about all the VPP stuff, John?
All the VPP stuff. VPP has officially launched. Go to our website. Website optimizations are happening right now based on your feedback. We are working on that. Join our circle group. It's free. It's a community where you can kind of vent your frustrations or seek answers from like people who may have solutions. Also tune in to the VetPractice Playbook every Wednesday. We're happy to help you. Lots of resources out there. Consider signing up for a masterminds or a consulting session. We'd love to be there for you.
We're taking you from survival mode to
thrival mode.
To what, Harrison? To thrival.
Thrival.
Oh, I like thrival as a word.
Thrival.
We've just invented a word. Thrivaling.
Yeah. We also invented sloppy lobby.
Yeah.
And we've invented some words, so you're going to have to, I'm coming up with we need a word for, you need to make an SOP for it, but we need a code word.
We need a code word for it. Okay, we can think of that.
Yeah.
I'm sure.
That's an answer to a lot of stuff.
Okay. All right. Well, in today's episode, we're going to talk about how to establish value when clients say it's just too expensive, because one of the things that is just making the circles right now, social media, is just veterinary care is too expensive, which means that then those veterinary professionals, support staff, technicians, assistants, DVMs are having to have conversations around care being so expensive. And so I thought, hey, let's tackle this as a group to see if we can give people even some actual language that they can use in an exam room that they can kind of memorize. Because once you have the first one or two sentences of what you can say in response, it really takes away a lot of the pressure when someone's like, well, that's too expensive.
You're like,
All right. So one of the things, Richie and I were talking about this morning, and he showed me this awesome, and this is not something you will say to a client, but it was a really cool way of thinking about expense. And do you want to go into that, Richie? Because I thought that what that gentleman was saying was so valuable. He's like, when he was saying nothing is too expensive.
Basically what he's saying is it's not too expensive. You just can't afford it.
Right.
And he said, if the problem is that it's too expensive,
then it is the problem.
Then the problem isn't it. It's that you can't fix it.
Right.
You can only fix you.
Right.
And I think the distinction he's trying to make is that if you don't want, and when we say you can't afford it, what we're saying is you don't see the value in it. You don't see the value in let's say something was $1,000 and they're like, I don't want to spend $1,000 for that. And they said, you're going to die in 5 days if you don't come up with $1,000. Then the values judgment on that $1,000 expenditure goes way high.
Mm-hmm.
So it's not about the number at that point. It's because the value jumped way up.
Well, and I think that guy was talking about the fact that if it is what is too expensive, then controlling you can't fix it, which is the whole point in veterinary medicine. They're saying veterinary medicine is the it. Mm-hmm. They're asking people to fix the it, and it's not the it that needs to be fixed. It's that the people need to understand that it's not our job as an industry to make healthcare more affordable.
And it's important to draw a distinction between what is affordable in air quotes.
Sure.
That's the difficult. I mean, affordability goes all the way to zero. So, I mean, that's the problem is there's a paradigm, I think, within the industry that things have to be affordable. Well, one person's affordable is another person's expensive.
Right.
And that's the difficulty is it's subjective. And that's why we preach that you have to set your price structure such that your return is appropriate. You can pay your people and all those things. And then you work backwards from there. And then it just costs what it costs to do what you need to do.
And I don't think, and I don't say that with harshness from the standpoint of it's not our job as healthcare professionals to make it affordable. I mean, we do create systems within certain, like at All-Star, we had a foundation where we could provide care to patients that couldn't fix a fixable problem. That's a system that was developed to be able to provide resources for those folks in need, right? So, I think that there are things people can do, but for you as a veterinarian to carry the load on your back so that someone else can have care is absolutely unsustainable.
Let me ask a question. I'm curious, do you think that people's or clinic owners' perception of their performance, that they just don't have enough confidence in their practice to see it is valuable to price it accordingly? You see what I'm saying? They don't see the value in their clinic.
I do think that's part of it.
Like that.
Sometimes that's
Like,
part
I'm
of
not
it.
good enough. I don't provide that level
I
of
think-
experience.
I think there is a paradigm in the industry that you have an obligation to be everything to everybody.
Yeah.
I think that is a lot of it.
You're a giver. Remember, we talked about that in the burnout session. If you are a giver, then you are expected to give at your own detriment. That's what society expects of you.
And what are your
which leads to burnout.
Yeah.
That's one of the main things that leads to burnout.
What you're in effect doing is then subsidizing others' decisions and choices. And that's eventually, there was another video I couldn't find. I was going to show it to Emily earlier today, where a guy said, I run a business. I am under no obligation to discount my services to accommodate your needs. And I guess it's harsh. It sounds, but I mean, from a thought experiment standpoint, I think it's really important to really internalize that and say, at what point am I willing to take a hit to accommodate others? And that's really what it is, right? I mean, a lot of it sometimes is when you're making those decisions, you're taking a personal hit. I mean, if your EBITDA numbers are 5% because you can't charge appropriately, or you won't charge appropriately, then you're taking a personal hit to subsidize others. Yeah. And that's just the way that, and that's not it personally, and the more I think about it, the more I get into these modules and I really, ponder some of these things, you have to have margin to be able to weather those bad times or to make decisions, things like that. If your margins are so tight, if they're, low to mid single digits, there's no margin there. I mean, you have to be really careful that you don't get into that kind of downward spiral. It's tough.
So let's talk about the difference between psychology and value. I'm sorry, that didn't make sense. Let's talk about the psychology and the difference between value versus price. Right? So price is a number. It's objective. It's fixed. And value is subjective, and it's built through understanding and trust and clarity.
There's one thing I want to add, and this is another video that I came across. And the guy was talking about solutions, and he said, people don't buy things, they buy solutions. He said, you don't buy a drill to own a drill. You buy a drill because you need a hole. That's what you're buying. I mean,
right.
you don't, so you value the whole, you value the solution. You don't necessarily value the implement that creates the solution. And I think that's where value comes in.
And that's what veterinarians, I think a lot of hospitals are not good at making the transition of talking about cost. They need to stop talking about cost and start talking about value.
And solutions, the value of those solutions that they provide.
Yes.
I think part of the challenge is because I consult and play in this vet med world, but I work in the human health care world. And I think people are expecting human health care, insurance, pricing, subsidies, support, cost, access, human health care models into pet health.
Absolutely.
And that's not the way it works. That's not the way the government subsidizes healthcare. You have Medicare, you have Medicaid, you have insurance companies, and it's a booming situation. And it's all designed. The whole goal is, hey, they want to make billions, and you need to have access affordable, and we have to figure out how this works. That is not the case in veterinary medicine. This is like you're shopping for a product. This is you're shopping for an experience. If you want a filet mignon, you can go to Applebee's, and I'm sure they have a Friday night filet. Or you can go to Ruth's Chris any night of the week, and it's going to be amazing, but you're going to pay for it. And this is a consumerism type of thing. You are a consumer when you're seeking pet health, and you're an insured individual in human care, and you can't compare the two. And to say like what Richie says is, should there be access for low income people to afford pet health. Yes, these are your nonprofit humane society type organizations, but should there be a prime level clinic that can offer like C-suite type of experience, a spa day for you and your animal that's even far beyond anything All-Star ever did,
Right.
where I don't care if I can pay for $2,000 for a clinic visit and they bring me a glass of champagne and a moist towel and a lemon wedge, and they got a bidet in the bathroom and a guy spraying cologne. Like, listen, let me pay my $2,000. That's a service I chose.
See, the interesting thing, I think, and we've all experienced this from a human healthcare standpoint, is that there is such a huge disconnect between the cost to provide the service and the actual cash cost to the consumer. And what I mean by that is that if you work at a job, like say, you work for the state and you get all of your health benefits paid for, you don't pay out of pocket for those necessarily. So when you go to the healthcare provider, there's no real exchange of money to do it. You just go get it and then you get a bill later. And so there's a disconnect, unlike in vet med where it's cash and carry. So there's no arbiter that's between the consumer and the provider, like there is between, in human healthcare. And I think that's the disconnect and it's one of the reasons that the costs are so much radically higher in human med than it is in vet med, because it's just that buffer basically. And that's what's hard. To your point, people want the same results and access and those kinds of things, but it's hard because of the way the system's set up. And one other thing I'd add is that I forget who said this, but it's in the context of human med. I'm going to butcher this a little bit, but they said you can have access, you can have affordability, you can have quality. You can have two of those three, but you can't have all three.
Oh, that's good.
You can have any of those, any combination of those, but you can't have, because a lot of people will say in the human, you have to, it's like, okay, you can have access and quality, but it's not affordable. You can have quality and, affordability, but maybe no access.
I think
and it's brilliant because you look and you go, that makes sense. Because then you can have whatever system you want. You just can't have everything.
And I think to the person that's out there criticizing, I don't know how you can charge that much for these services. Well, the answer, if you're a premium vet clinic to that person, well, I don't know how you can provide that poor of an experience,
right,
and call it okay.
Well, and I think that's interesting.
So it's a quality / experience issue that you can't put in one lump sum.
Right.
It's consumerism.
Well, it's so interesting because no one spends any time talking about the other side of the coin, the poor experiences, the poor outcomes, the pets that are treated, like subpar care at facilities. And, nobody talks about that. Nobody talks about the veterinarian who runs an ER practice that, does everything in the book that's unnecessary and charges a client $2,000. Nobody's talking about that, or the fact that someone is charging $40 for a spay. What are you getting for $40? That should be your question. I would be concerned, when it's not subsidized by the government, like a humane society and whatnot.
Right.
What is actually occurring that you can only charge me $40? So those things, those sides of the conversation, for whatever reason, are being left out. And I think that that's really important to hold those people accountable as well.
I think, to your point earlier about Ruth's Chris versus say Applebee's, I think that's such an important example because they're both steaks. Yep. Two completely different experiences. A Lamborghini versus a Kia, both cars, both get you to work, two completely different experiences. And that's, to your point, I think that's really, that's key because, you get what you pay for a lot of times, so. So
when clients are talking about objections or when they're objecting to price, typically they're asking themselves these three things. Is it really necessary? Is it actually going to help my pet? And can I trust you to guide me wisely? So it's really important that as we craft a response to the objections, that we're not trying to sell somebody on something. You're actually trying to change their train of thought into thinking things or providing solutions like clarifying the problem, translating medical risk so they actually understand what they're giving up. So if you're not going to do this, you're giving this up, which as long as you understand that, then we're all on the same page. And then aligning treatment with the client's goals and values. Like those are the things that you need to focus on when you start to address the objection. Okay.
Yep.
I think it's important too to look at, I mean, to your point about not selling, I think it's important to choose your client before they choose you.
Mm-hmm.
I think that if you position yourself accordingly, then a lot of these things people talk a lot about in sales training. I mean, qualify your clients before they ever come in. I mean, make sure that they are an appropriate fit for whatever it is, product, service you're selling. And I think if you do that, I think it cuts down on a lot of the consternation that probably comes with trying to hard sell people all the time.
And I think that you have to look at things when you walk into a clinic. For instance, I know we like to use All-Star as an example. That's where it was. But you get out of your car at All-Star, somebody's going to open the door for you when you walk in.
Mm-hmm.
There's somebody not sitting behind a reception desk. They're behind a kiosk, and they will come out from behind it and talk to you. So there's no barrier come customer service.
Mm-hmm.
If you get a bag of prescription dog food, you will not carry it to your car. Somebody will carry it out there for you and put it in your trunk.
Mm-hmm.
They will make sure you're out okay. They will open the door when you leave. They will greet you with a smile. There was a person there responsible for following up with euthanasias, things like that were caring for clients, sending flowers or pet paws or organizing all of that.
Mm-hmm.
Those experiences people are willing to pay for.
Mm-hmm.
And people want that. And you can't go in there with a small bill, small clinic mindset and lavish in these luxuries and not expect to pay for it. That person making those phone calls, that person opening the door, the person carrying dog food out, they all get a paycheck at the end of the pay period.
Mm-hmm.
You're going to have to pay for it. And like what Richie's saying, hey, if you want to be that kind of a clinic, great. Build it, but be confident in it and stand behind it.
Yep. Absolutely.
And I think competing on price, I heard somebody is a different context where when you're competing on price versus value, it's a race to the bottom because there's always somebody cheaper, always somebody willing to do it for, at a smaller cost. And it's literally a race to zero because if that's, you'll churn clients. It's very hard to compete on that basis and that basis alone, unless you're a nonprofit and you're being subsidized, you're a low spend. I mean, and sometimes that's your mission. Your mission is to do it for as close to free as possible because you want to service the public in, say, a spay neuter context or whatever, which is great. I think it's awesome to be able to do that. But if you're a for-profit operation, it's very hard to compete on that basis.
Quick pause to tell you that VetPractice Pro is officially live, and it's designed for veterinary professionals and practices who want practical tools, not fluff. Right now, there are 15 on-demand courses covering leadership, human resources, and customer service, and more, plus over 40 downloadables and 10 ready-to-use SOPs. And the best part, we're adding new courses and SOPs every single month. So it keeps growing right alongside you and your team. If you're looking for education you can actually put into action for yourself or your practice, visit vetpracticepro.com. Okay, so we've listed 4 steps that somebody can work through as they're trying to craft a script. And we'll give people a script here in a couple minutes, but that they could actually use. But if you're trying to come up with your own way to handle these objections, we've got like a 4-step process. So the first thing, acknowledge the emotion. So that's really important. You don't want to pretend like you don't recognize that they're upset or frustrated or surprised, right? I mean, if you just gloss over that, that's not going to go well. Right? I don't think. What do you guys think? Right?
Sorry about you.
Yeah, exactly. Do you have anything to add about that? Like when you've been in a room and have experienced that?
Yeah, I mean, I think you can definitely tell there's some tension in the room. So you need to address it. I think, again, going over everything, like what we did at All-Star for estimates or treatment plans or anything, is we didn't even talk about the cost. We went over everything and why we recommend everything, and it was the best care. And then we would work backwards. If they couldn't afford it at that part, then it's like, okay, well, let's work backwards then to try to still get the best care.
Yeah, absolutely.
Leave with value, follow the price.
Yeah.
That's big.
So step 1, acknowledge emotion. Step 2, recenter on outcome. So shift the conversation from dollars to purpose and impact. And, I was reminded of this when I was, again, at VMX this past conference. And we were talking on the Zoetis panel about how to do this, how to shift from cost to value. And I think if you can talk about the things that the problems you're going to solve by using, so if we use example, the drug we were talking about was Librela. If we're going to, because that's an expensive drug. So you're comparing, what most people want to do is compare Librela to an NSAID. Librela is going to be more expensive than an NSAID. What you actually want to do is compare Librela to the things that Librela removes for the pet or for the owner. So for instance, you no longer are going to have to worry about compliance fatigue, right? Like having to give a pill every single day. You're not going to have repeat lab work, every 6 months because you're on an NSAID. You're not going to wake up to accidents in the middle of the night. All of these things, your dog's going to be more mobile and be able to go on longer walks with you. All of these things are worth something. So using those as a way of talking about the value of the drug instead of Librela's $116 and this NSAID's $55.
Right.
When we use Librela, we're going to be able to prevent this and we're going to do this and it's going to cause this. And, so I think that's so powerful because those things do cost clients something.
Well, they're naturally going to just go towards the cheaper one, the cheaper option without knowing anything.
Right.
So if you set them up to let them know, okay, this medication can do this. We have another option, but you're going to have to do pills every day. You're going to, they're going to have an upset stomach, whatever it is. And then it's their choice.
Yeah.
But you can't just say, I have this med for $100 and this one for $30. Which one do you want?
Which one do you want?
They're going to choose the cheapest one.
And one of the things that I'm taking this class down, the guy keeps talking about is about features tell, benefits sell. And if you could have all the greatest features in the world, but the benefits are what really actually close the sale for you. What does it actually do?
Time. What's confusing? Right. What's the solution?
Yeah. What's the solution? What does it do? And I think that's so powerful because if the benefit, if you can convey the value that the benefit offers versus say the lower cost solution, that's the benefit that should allow you, or at least help you to close it.
Right. Absolutely. And get the pet the care that they need, right? That's what you're ultimately chasing. So clarify options, right? So there are, to your point, Kayla, going to be people that can't do, like initially what my treatment plan is,
and that's okay.
And that's okay. I think then working backwards, part of our responsibility to some degree is allocating funds in an exam room. And so, and it falls on my shoulders to guess without diagnostic tools some of the time. So then I'm going to use or recommend the diagnostic tools that are going to help me guess the best for that situation. And that might look different from case to case, from patient to patient. This vomiting and diarrhea dog, I might be like, I don't need a fecal. And this one, I might be like, I need a fecal. If it's a puppy, it's 20 weeks old. I'm like, I probably need to check the fecal. I'm not going to forego that. But in a 5-year-old dog, it's been on heartworm prevention every month. I'm going to get rid of the fecal, So like, I think, knowing what you can allocate, in terms of diagnostic tools and then helping the owner. I think that's also something that builds trust with the owner so that when you are up against a wall in the future and you have a hemoabdomen and the only thing you can do, the absolutely only option that you have is to remove the spleen to save the dog.
Yeah.
We're going to remove the spleen.
So you're essentially developing your treatment plan with a gold standard, a silver standard, and a bronze standard by prioritizing what the animal needs most and what you need most to establish an accurate diagnosis.
Yeah.
And you can tailor that accordingly is essentially what you're saying based on those people's financial
and values. Some people don't value their pet that way.
Yep.
Right? So somebody's like, it's a dog. And you're like, okay, I'm not going to convince them to do everything, like sometimes in those situations, they're going to euthanize instead of do a splenectomy. And so I think I try not to present them as gold, silver, bronze, because I don't want to devalue their choice.
Oh, totally get that. Yeah.
So, like I would never, like back in the day, that's how they would tell us to do it, would be to use like, this is gold standard care. Like we talk about that amongst ourselves. Maybe, like, okay, this would be the gold standard of treatment. But in an exam room, I don't talk about it that way because ultimately what they can do is what they can do. And I don't want to make them feel poorly. I don't have an interest in them feeling poorly about themselves, because they have to choose their kids over their dog.
Right.
For this instance, in the season of their life. And so I think we've learned that's not how to present things.
That's great.
Yeah. Okay. What was the last thing here? Oh, invite partnership, right? So empower the client into the decision instead of positioning as yourself as the authority versus the consumer.
Mhm.
So, and you'll hear some of this in the scripts, like asking, what's the hardest part of this decision for you? Is it the money? Is it that you don't think of your pet this way? Is it like, so inviting them into making that decision, I
Mhm.
think, and acting as a guide versus,
Yep.
the white coat in the room.
Right. Like, this is what you're going to do. Mhm.
Yeah, I think you're going to have better results. Okay, so when a client says that's just too expensive, I wrote down a couple of just like responses
Mhm.
that maybe, Kayla, I don't know, what do you think when you read these or read these? Sometimes Richie brought up a good point this, earlier today, is like, how much time do you actually have in a room? And it's like, well, it does
Yeah.
vary. Like I can't spend an hour talking to an owner about a treatment plan, but I try to, over the course of my exam, establish value such that then it minimizes the amount. And of course, the longer you've known the owner.
Yeah.
So this is a 7-year-old dog. You've taken care of them since they were a puppy. The conversation's a lot shorter. And then it's a new client coming in. That's going to take longer, right? Because you have to establish trust.
Mhm.
So what do you think about the scripts?
I think they're good. It's really just making sure they understand the value of the services, really, is what it all boils down to. I just know, like, going into, like what I said before, with our treatment plans, again, you're not talking about the numbers, you're not talking about anything. It's just, again, not really saying the gold standard, but we're going to present them with a gold standard of what we can do to help their pet, and then work backwards.
So in this response, I completely understand. It can feel overwhelming when you're not expecting a number like that. That first sentence is a lot of times all that you have to memorized,
Mm-hmm.
because then you can go from there. You can think of the other things that you can say, or to build your script. So for example, we wrote this one. So I completely understand it can feel overwhelming when you're not expecting a number like that. Let me step back for a moment and make sure I've clearly explained what this treatment actually does for Fluffy. Because the goal isn't just the procedure, but it's what gives Fluffy back, right?
Yep.
So right now our biggest concern is, and you're going to restate what the problem is. So right now if we're using hemoabdomen as an example, right now Fluffy's biggest problem is that she's bleeding into her abdomen, which is causing her hematocrit to go low, which will in a short time period cause death.
Mm-hmm.
And by short time period, I mean over the next 24 hours. Right. So I've clearly explained what it is that's causing the problem, that's making me want to make the recommendation that I'm making.
Mm-hmm.
If we don't address this, the risk is, right? So we address that, the pet dying in this situation. This treatment, so this surgery gives us the best chance to, whatever it might be, keep Fluffy with you for a longer period of time so that you can continue to experience the human-animal bond. Or maybe it's so that you can get your kids home from college so that they can say goodbye, so that you can spend the next 3 or 4 months, whatever, after your time in the room with them, you would have something that you would put there. And then lastly, that's what you're really investing in, not just the test or the medication. So if it's something that's not life-threatening, they're really investing in the benefits, like Richie was talking about, the benefits of being more mobile, not having to have, like we're talking about Librela, not having to have blood rechecks, not getting up to accidents in the morning. That's what you're investing in. And then when they're like, since that they have an objection, then you're going to be like, can you tell me what it is that is the hardest part of making this decision? And then you can come back around and address those specific things for them.
And investing is a key word, because with investing is you're expecting a return.
Yeah.
So, and that's a great, because it's not just a cost. it cost me, to get a gallon of milk. But you invest. Not that you invest in a gallon of milk, but the benefit, the ROI with that investment, whatever that is. Depending on the situation.
I think in any chance of being a consumer, you're a lot easier to spend, invest, reap the benefits, or purchase the solution if you understand wholeheartedly the value of what you're getting. What am I getting for this amount of money? And leading with that, and knowing what you're trying to achieve. Like you said, maybe it's just more time with my dog,
right?
To buy some time. Give me a week or two. Let me process this so it's not so sudden. Or is it, no, we are going to I'm going all in. I'm gonna and how much are you willing to spend on a week? You know, as a
Yeah.
consumer, I'm gonna say, okay, this is what it is.
Absolutely.
You're telling me it's gonna be $2,000, and I'm gonna get maybe a week or two. For some people, they'd write a $4,000 check for a week or two because money isn't their priority. It's
Right, it's
that
time.
week or two.
Yeah.
For some people, they're gonna say, no, as much as I want this week, it's just it's not worth.
It's not
that
responsible.
to me. It's
Right.
not responsible, and it's
Mhm.
not worth that to me.
Mhm.
And I think that there's this whole big lump sum of the cost of veterinary care, but really what you need to do is offer the solution to your client.
And
You
it's
know,
going to vary depending upon the client and the pet.
yes, like,
Absolutely.
hey, we have multiple solutions for you to choose from. And I understand where you're at. This is what we can do to try to help. Now you're building a relationship of trust
Mhm.
that, hey, they're gonna, who's ever been to a store that, like, let's say a hardware store? Hey, you guys have this anchor, this wall anchor. No, we don't sell that kind, but if you go to Jay's Hardware down the street, I know they sell them. I'll go back to that first
Yeah.
hardware store every time because they are going to give me, if
They got
they don't have the
credibility.
answer, they're going to give me an option.
Yeah.
And what you're doing is you're giving them options, and they'll keep coming back because they like the way that's presented. They get to determine their value. They get to determine what they're going to get out of it for their dollar. And I think going through these scripts, you've absolutely positioned them in a time where they feel like they have no control. Because you do. When that bill comes, you feel like you have no control over it. You're putting them in a position of control as a consumer. That's the spot I want to be in.
Sure.
I want to be in the position of control. So I think that's absolutely great, that script.
Okay. I think that we probably don't need to go over the smaller version because
No.
I mean people can kind of take that first one and
Make it shorter.
make it shorter. Yeah. So let's see here. What else did we want to talk about?
I will say real quick one thing. I went to a sales training class once in Chicago years ago, and specific for vet med, and he talked a lot about, and this is more of a systems problem, but don't assume that people can't afford the best
sure.
care.
Yeah. That's why you always present them.
Yeah,
with,
and he actually had video in a video from an exam room, and he said, these two people look like there may be a differential in terms of what they can afford or what they're willing to spend, but the guy who looked like he didn't want to spend anything was actually the guy who would do anything for his dog.
Mhm.
So it was an
And I
interesting
think I've
comparison.
seen that multiple times.
Have you seen? Okay.
And just working at All Star and then training other people in exam rooms of, it's like, don't judge the book by the cover.
Yeah.
Right.
Like, just, the ones that you don't think will pay will pay.
Yeah.
Yeah.
Don't assume anything.
Yeah.
Absolutely.
And sometimes.
So the closing takeaways, I guess what we'll kind of just run through those real fast. Price objections aren't rejection. They're invitations for clarity, which is hard to convince yourself of that because it's super easy to be like, okay, thanks, bye, and walk out of the room. But you really need to train your staff to provide clarity. If it's not you in the room, they really need to provide clarity to make sure that that pet is going to get the care that they actually need. When teams confidently communicate value, everyone wins because patient care gets better. What else?
Clients feel respected and informed. Your teams feel empowered instead of defeated. And clinics stay financially healthy without compromising integrity.
There you go. Okay.
Good deal.
Anybody have anything else to add on value versus cost? Value is an emotional decision, and people make decisions based on the emotional side of their brain and justify it with logic. And that is why it's so powerful to talk about value and benefits and solutions versus cost.
And you will definitely hear more about this. I can guarantee it. Through us moving into the future, this is a never-ending circle because of the subjectivity on the consumer side and the provider side. This is always something that people are going to have different points of views and perspectives on because whether you're the owner or the consumer, it's value-based.
Value-based. Okay.
Well, that's it for today's episode of the VetPractice Playbook. We hope you got a few plays to use for yourself or for your clinic. If you enjoyed this conversation, share it with others, leave us a review, and check out vetpracticepro.com for tools and courses that can take your clinic to the next level. See you next week.
See you
Bye
next week.
again.
Bye, guys.